Good morning, everyone. Welcome back to my YouTube video channel. I am excited again to invite Dr. Emily Stopper, the Diplomat of American Board of Sleep Medicine. She's on our channel today to bring you guys the information about how you can practice dentistry without, the typical drill and fill. Dr. Emily, I'm honored to have you here. Can you share with us how did you start to go from a regular dentist to a very specific kind of dentistry that you are doing daily right now and teaching
Yeah,
as well?
absolutely. And I'm honored to be here. Thank you for having me. I appreciate it. But yeah, my journey into dental sleep medicine really came from being pretty burnt out with general dentistry. And that's really ultimately what was my motivation to, really explore more about dental sleep medicine and what that could do for not only me, but my patients. And I also had a very close family member who was suffering from sleep apnea. And at the time, I had heard about dentists, helping with snoring, and I'd heard just a little bit about sleep apnea, but I knew very, very little. So when my mother-in-law came to visit, she normally didn't stay with us, but this particular time she slept on our couch. And our bedroom, my bedroom was upstairs, and I had a little landing area, and I could hear her. I was at the landing. I could hear her stop breathing. I could hear her coughing and choking and gasping for air. She had a CPAP, but she didn't bring it with her, which is very common. People don't like to travel with their CPAPs. They're not all that portable, hard to clean, noisy. It's easy to forget parts here and there, but she didn't have her CPAP, and it was a very scary night. I just heard her continually cough and choke and gasp for air. And I realized this was probably a pretty typical night for her if she didn't have her CPAP. And on top of that, she didn't, she confessed she didn't really wear the CPAP all through the night either. So I knew I had to do something at that point. Like I knew there was something that could be done. I'd had patients even ask me for an appliance. A couple of patients had asked me, and at that time, I didn't know, what kind of appliance to use. I didn't know how to take the bite registration for an appliance. I was starting at square one. So that was, there were a couple things that sort of came together in the perfect storm. It was me thinking, hey, I don't know if this general dentistry thing is really my passion. I love being with my kids and my family, and I don't want just to like constantly hear negativity, like, I hate the dentist, I hate needles. There was just a lot of things all at once that kind of gave me the impetus to change something. And so when I learned about dental sleep medicine, I jumped at the chance to find out what this was all about and how I could help patients in a whole new way.
Okay, so, so wonderful. So Emily, can you explain to those of us that don't have a very clear picture of what exactly sleep anemia, like how do we define a patient who have that problem? Can you share with us, please?
Yeah, absolutely. So, statistically, somewhere between 20 to 37% of our patients actually have sleep apnea of some form. And, what that really is they're stopping breathing when they're sleeping. There's not any air going in or out, and they're just basically holding their breath for at least 10 seconds at a time. Oftentimes when I see my patients, I'm looking at their sleep studies, and I've seen 2 minutes where they've stopped breathing throughout the night. And this causes it's so much wear and tear on the body. If you think about how often this is happening, hourly for these people, it's their body's more stressed when they're supposed to be resting than it is whenever they're actually sitting up and talking to me. I'll see heart rates, on these sleep tests. I'll go over these with the patients, which, by the way, I feel like is one of those that's kind of one of the pearls that I could pass along to anyone else who is doing dental sleep medicine. When you sit down next to that patient and you have their sleep study, and we're sitting talking just like you and I are, and I'm pointing out on their sleep study, did you know your heart rate went all the way up to 120? Did you know your oxygen dropped down to 79? I mean, when you go over that kind of information with that patient, it becomes more real to them, because who wants that to be their true numbers? I mean, it's very scary to think about that. So knowing that at least 20% of our patients have some form of sleep apnea, and there's something we can do about it. Most of these people are undiagnosed because it's not really commonly looked at when people go to their physician. So if people complain about not sleeping well, more than likely what's going to happen, they're probably going to get a sleeping medication. It's not going to necessarily be sleep apnea. That's the first thing that's looked at. So anyway, I'm a big proponent of like, let's at least have these conversations with our patients, find out if they might be at risk, and then help them get to that next step where they can get diagnosed. And that if a dentist does nothing more than that, then that's a tremendous help to our patient base.
Right. And not to mention that from your statistic information that you in your court, you mentioned that 90% of these people are undiagnosed. And then if you are not diagnosed, you have 5 times more likely that you're going to develop some kind of cardiovascular disease.
Absolutely.
And that is 5 times, that's the risk is very high to take. And also we think about like our family member or our friend, those 1 out of 5 of those people have potentially this kind of problem that if we are expert, we can help them, correct?
That's right. Yes, absolutely. Yeah. I mean, you think about how many people are affected, how many people are undiagnosed. But typically our family members know, like people come in and say, oh, my dad needs to come in, or my husband or my wife needs to come in, because they're, you can start that conversation in the dental office, how are you sleeping? Are you waking up at all through the night? Is anyone telling you that you're snoring? And even if it's not that patient, they'll know a family member, just like you said. And if a family member does have sleep apnea, so, if a close relative has sleep apnea, then there's, a much higher likelihood, at least 3 times more likely that, that you have it if you're the family member. It's very, very common in families because of our internal anatomy. Our airways are very similar. And so we're more likely to have that if we have a family member that has it. So it's absolutely one of those things where, it's very common. People may kind of joke about, oh yeah, so-and-so snores, but snoring could be that red flag telling you that you can't breathe well when you're sleeping, which impacts your heart. Just like you said, it makes you so much more likely to have all these other health conditions. People are worried about getting Alzheimer's, dementia, having heart attacks, all these risk factors. Really, we could be looking at sleep apnea as one of those root causes, because if we can't really even, our heart is it's an important muscle, obviously, and it needs some rest too. So we don't want it pumping so hard throughout the night and so fast that, you're wearing it out at a much higher rate than it should be, because people with severe sleep apnea, it's been well documented that it's cutting probably 5 to 10 years off of their lives because of it.
Right. So Emily, the one thing I want to jump right in is the sign and symptom of the sleep apnea. I know it, hypertension, acid reflux, depression, snoring, choking, grasping, insomnia, weight gain, brain frost, especially sleepy in daytime, all of that. But one of the things that I was talking to the oral surgeon is, I asked, like, if you don't have snoring problem at nighttime, but you are tired on the daytime, or you might have insomnia, is that also considered more or less you run into the sleep apnea category?
Yes, yeah. People can present in different ways. I mean, because sometimes people will be extremely tired. Like sometimes I have people that sometimes fall asleep in my dental chair while we're talking. And we've all had those patients where they fall asleep while we're working on them. I mean, if someone can fall asleep in the dental chair while being worked on, they probably should have a sleep test. But if someone's sitting there talking, I've had patients who have, I have one lady, she fell asleep on the back of a motorcycle as a passenger, and thankfully she didn't fall off. But, like it's that bad. It can be that, kind of that far on the end of the spectrum of being that exhausted that you can't stay awake when you're driving or in a car. But then you also have those people who are not necessarily presenting as tired, but it's sort of like what's normal and what's not normal. That maybe they're kind of, they've kind of felt like, okay, well, this is just normal for me now. I'm just going to be tired all the day. And and they don't even realize how tired they really are until they get treated for that. And then they're like, wow, I have so much more energy now. I don't wake up tired first thing in the morning. I don't need a nap by 10 a.m. So people present, in different ways. And I feel like
you have to have snoring in order for you to be.
you do not have to snore in order to have sleep apnea.
Would you go quickly, like in terms of like the screening test and help the in the office, and how do you identify the potential risk of patient?
Yeah, absolutely. The screening can be very, very simple. It doesn't have to take a long time. One thing I like for teams to start thinking about is even just looking at, like, if you have a morning huddle, or if your hygienists can start, or assistants can start looking at patients' health histories, we need to look at those anyway. Why not go ahead and look, okay, does Mrs. Jones have multiple blood pressure medications? Does the acid reflux, taking Tums or Prilosec, any kind of those things. Do they have AFib? I mean, right away, what I just mentioned, those people need to have a sleep test if they haven't already. People with atrial fibrillation are much more likely to have sleep apnea. They almost go hand in hand. And if we just start looking at health histories and start identifying some of those risk factors, when you look in the mouth, you're really looking at the same structures that you would look at for your oral cancer screening. So just look to see if the uvula hangs further back. When they open, can you even see any airway? Does the tongue take up too much space in the mouth? Is there a lot of wear on the teeth? Sometimes you look at those patients that have a really big overjet and you think, and then they've got a lot of wear on their anterior teeth, and you're like, how does this person, they have to really kind of jut that lower jaw out to be able to grind those front teeth down. And so it's just kind of putting these pieces of the puzzle together and saying, look, I see these issues. Why don't we at least get you sleep tested? I mean, even something as simple as the scalloping on the sides of the tongue. Like, I think most of us have seen that, where it's almost like, you can see the little indentations of the teeth on the edges of the tongue. That could be a huge warning there that, hey, this person, at least partly through the night, probably their tongue is pushing up against the back of their teeth because it's trying to get out of the airway. They're trying to get more airflow. So, those are just some of the simple things that we can look at. And if you want to do more of a screener, the stop baying is a good one. I really like the Berlin questionnaire. It's just like, it's 10 questions, and it does ask about snoring. It asks about blood pressure. So getting a little bit more detailed with that. And then one other questionnaire, which I don't love, but it's one of those things that if a patient's going to have a sleep test done, they need to have this questionnaire filled out, which is the Epworth. So it's the Epworth Sleepiness Questionnaire, which just kind of is a measure of how drowsy someone is during the day.
One quick question before we jump in another topic. What the reason why is there any relationship why acid reflux can be a risk of sleep apnea?
Yes. Yeah, great question. I talk to my patients a lot about this because if you've ever seen someone go through an apnea episode where they really can't get the air in and out of their body, their diaphragm is still working. And so basically you see them, there's just no air going in and out of their mouth or nose, but their diaphragm is still working. And so it's pushing. And so they're pushing, and they're pushing up, trying to breathe out. And what ends up happening is the acid ends up getting pushed up instead of air. So a lot of times people will wake up, having a hard time catching their breath because the acid comes up, and that starts kind of that choking and gasping and having difficulty breathing. And a lot of times that's a very strong motivator for people when they have that happen, because it's hard to catch your breath when those episodes happen.
So the obstruction making them allow the telling the diaphragm have to push it up to create some air.
Yes, exactly. Yeah. Their body, you can see it's almost like a convulsion with trying, you see the body trying to breathe, but instead it's just, the pressure from the diaphragm pushing the acid up.
And what about the obesity and non-obese? Is this really related to sleep apnea, or it doesn't matter?
It is related. It's definitely related, but it's not, you can't just look at someone and say, especially like someone thin, you can't just look at them and say, oh, you're thin, you have a thin neck, you don't have sleep apnea. You can't do that. It's because I've had quite a few patients who actually are almost underweight and still have sleep apnea. So being overweight is a risk factor, and the size of the neck makes a difference. And if someone does lose weight, I mean, that typically does reduce the severity of the apnea. It doesn't always get rid of the apnea, but it can help. And but yeah, you can't just look at someone and their weight and know whether they have it or not.
Thank you. And what about the sleep test? Do you prescribe, or the medical doctor do that?
Yeah, the medical doctor really needs to do that part. It's one of those things where, as the dentist, it's really us trying to collaborate with the medical community. So I really recommend, referring to either, if you have a local medical provider that you can work with to get the patient sleep tested, that's wonderful. Not all of us have that, option. So another option would be to do like a third party where you can refer to that sleep testing company where they can have that medical doctor on their staff there. And that, a lot of times that streamlines the whole process, because that way you don't lose your patient along the way, whether they never go to that local doctor or they perceive a sleep study as something where they have to go sleep in a lab and they don't want to do that. There's so many different options, but I do recommend however you do it, to make sure there is a physician involved, because that sleep study really needs to be scored and interpreted by the sleep physician. And then ideally, we hope that they'll write that prescription. If the patient is a candidate, we hope they'll write that prescription for them to come back and do the oral appliance. But certainly there are ways to streamline that, and that is what I recommend. We want to collaborate with our physicians, and we want them to know, hey, we're in this for the right reasons. We're trying to help our patients. This is very underdiagnosed. We can help, especially with the CPAP recall. I started to say recent CPAP recall, but it's been going over a year now. And that's still a pretty major issue. And so for us to be able to step in as dentists and let these physicians know, hey, we can help. Like, if these patients are waiting 6 weeks to 2 years for a CPAP, let's raise our hands and let them know that we're here, that we can make a positive difference while they're waiting. Or, hey, they may do so well on the oral appliance, they don't necessarily need the CPAP.
Right. There is a lot of device that they sell online to say, hey, you can test yourself whether you have sleep apnea. Do you recommend dentists to talk about that to patient, or patient to buy it themselves, or just don't do anything like that?
I don't really recommend that. I'm like I said, I really am big on having a system within your office to just pretty much try to get everyone on that same workflow, just to make everything simpler for everyone. So if instead, it's kind of the same thing as, like, we don't want the physicians telling our patients to go get a night guard, on Amazon. I would like to work with medical practitioners that I know, and it can be a third party company. I just don't recommend like going necessarily online just to get a device. I mean, something like an Apple Watch or a Fitbit, those kinds of things, they're nice as far as, they can give us a little bit of data, but we really need to have that true sleep test, which can be a home sleep test, but it's just like they say on those watches and things. It's really for entertainment purposes. But at the same, kind of on the other end of that, I have had patients to even come in because their Apple Watch or their, whatever kind of device they have has told them that they're not getting REM sleep, or it's told them that their oxygen has dropped, something like that. And that's encouraged them to come in and get checked out. So I'm not against those devices, but ultimately I want those patients to go through the process of talking to a sleep doctor, getting the sleep test done. And, that way we've got everything we need. We need that sleep test. We need the prescription, and we need the clinical notes from a doctor in order to really have our ducks in a row for treating the patients.
So most patients have to go to a sleep center, or they can test by at home from the doctor prescription?
Yeah, no, yeah, most patients now can go through a home sleep test. If they're going through medical insurance, so sometimes it's insurance dependent on whether that insurance will pay for a home sleep test, but most of them will. So yeah, for the most part, it's now going through the home sleep testing option, which I think is I think it's wonderful because a lot of patients don't like the idea of having to go to a lab to sleep, and they feel like, well, I couldn't go to a lab and sleep, or if they have children at home, they don't want to go sleep somewhere else, or if they're caring for a parent and they don't want to go and have to be away for a night. So having that option of the home sleep testing is fantastic, and it's adequate for what we need as far as testing for sleep apnea.
Thank you very much, Emily. We have about 8 minutes. Just one last couple of questions. So in terms of treatment, the ability for dentists to help our patient, what are the therapy that we provide for them?
For the therapy that we can do as dentists?
Yes.
So a mandibular advancement device is what I do. That's basically the way we can help bring that lower jaw in a more stable forward position, keeps that tongue from falling back and blocking the airway. It also helps to keep those muscles in the back of the throat more taut instead of letting them be collapsible. So the way I talk to my patients about it is we don't want your airway to be, squishing down at night. We want it to stay nice and open, like a water hose. So instead of it just kind of deflating when we lay down, gravity takes over, tongue flops back, and then we have that obstructive airway. Instead, I compare it to the CPAP, and I talk to them about how the CPAP mask is going to fit over their face. It's going to constantly blow air down their throat in order to keep that airway open. Whereas with a dental device, we're able to just make something that fits over the top and the bottom teeth. And it, like I said, it stabilizes that lower jaw in a more forward position so that we can have more passive airflow throughout the night. I have a couple of samples here. I have a few that are my favorites. This is the Prosomnus IA. And so you can see it's just got these little fins on the side.
Yep.
Keeps the lower jaw forward. Another one with just a little different device design is this. This is the Somnomed Avant, which has the little strap here. And then one of my other favorites here is the Panthera, which has the little rods on the side. So all of these are able to be adjusted by the patient as we start. We start in more of a comfortable position for the patient, and then we sort of ease them forward into the position where subjectively they're feeling better, that they can come back and report to me that, hey, yeah, my bed partner says I'm not snoring anymore, or I'm waking up with more energy. But all these are adjustable so that we can make it fit in the most ideal position for the patient.
I see. Now, with this appliance, do they have another device to also help them to monitor their heart rate and things like that in combined for us to really have a better report?
Right. So there's nothing like that. For the most part, there's nothing that's really going to monitor these directly, like each night from the device. There are some things in the works I know for as far as being able to know on a nightly basis how the device is working. Otherwise, we're sending the patients home with either a pulse oximeter to test their oxygen to make sure the appliance is doing what we want it to do, or send them home with a portable sleep test and monitoring one or more nights to see, what the perfect position is for their airway, how we can, get the best numbers objectively, where we see that the heart rate's not as high, see the oxygen is better throughout the night. So there's lots of different ways to monitor that, or just sending them back to the physician and saying, we think we have reached the position that's ideal for this patient, and would you please go ahead and sleep test them and find out where they're at now.
So usually what, 2 months, 3 months, 6 months before?
I go ahead somewhere between week 4 and week 8 and send them home with a sleep test to see where they're at. I don't usually do it earlier than that, but at that point, I would say somewhere between 4 to 12 weeks, we have a pretty good idea of that best position for most patients. And, obviously all patients are different. Sometimes they adapt really well and we hit that, perfect airway position right away. Other times it takes a little bit more time, an adjustment period. But for the most part, it's between that 4 to 12 week mark.
Could you give us one example of your throughout your experience with the sleep medicine? One or two example where you changed the patient life, and there was a, they came and they just show you so much appreciation. Can you just share one or two story?
Oh yeah, this is my favorite part. I feel like this is just so rewarding because of that. I had one patient who he actually drove, an hour and a half to see me. He had tried CPAP for years, and he said at this point now it was in his closet. He just stopped wearing it. But he was a police officer, and he would sit at his computer, and he had an Apple Watch, and he said all of a sudden it would just it would warn him that his heart rate was too high, and he was just sitting there. And he knew that he needed to do something. He knew he'd gone too long with not treating his sleep apnea. He went to his sleep doctor and just said, "Hey doc, I just can't do this CPAP thing. It's not working well for me." So when I saw him, he said he was exhausted. He couldn't even sleep with his, in the same bed as his wife because he was so restless. He would tear even the fitted sheet off of the bed. So he just could never sleep well. When we delivered his appliance, we saw him for a 3-week follow-up. And I remember his face just really well that first day. He turned around, he smiled really big, and he said, I lay down on my right side and I wake up on my right side. And he said, it's amazing. He said, it's changed my life. And it's like, he's got more energy. He's not grumpy with lack of sleep. He's got a new grandbaby. Now he has energy to play with her. So it's just really rewarding when you hear these people come back. It's not just a better night of sleep. It's changing their whole life. It's giving them more energy to enjoy the people around them, and to not wake up and feel like they need to go back to sleep immediately. It's amazing what it can do for people.
I can relate it to that. Most people who are in labor work or police officer, like my patient too, most of them have sleep problem for sure. Because the stress level that they do, and the time that they don't have enough time for their body resting and taking care of themselves.
Yeah.
Can you share with us how we get to approach your course? And you mentioned that you did also have a club where you can help and support the dentist. Can you share with us some of those?
Yes. So yeah, when I first got started with sleep apnea, I found it, there were good courses out there, and I went to a lot of those courses. But it was sort of like putting all the pieces together was what was really difficult. And it's like, well, how do you do this? And what about this? So what I did was I put together an online program, but also it's a mentorship program. So I've been doing this for over 5 years now. In fact, it's all I do in my practice now. I only work 2 days a week, and I only see sleep patients. So I've niched down my own personal practice to only doing dental sleep medicine, even though I do have a dental practice as well. I just work, within the walls of my practice as a, in dental sleep medicine. I have associates who work and do the general dentistry. So what I do is I mentor other dentists to help them be successful in whatever they want to be successful with this, whether they want to do something like I've done and really, only focus on sleep, or if it's just a matter of, hey, I want to offer my patients a new way to be healthy. I see this all the time in, my patients. So I really want to be able to treat them and help them with this rather than just referring out or doing nothing at all. So I mentor dentists in how to put all the pieces together, even the medical billing component. A lot of people struggle with the medical billing part because it is so different than dentistry. And they need help knowing, okay, how do I get my patient from, hey, we screened them, to back in the chair for the actual appliance? And there's, obviously there's pieces that have to go into play there. So that's what I help them with. I do have a YouTube channel as well, and it's the Happy Dentist YouTube channel. That's one of the best ways to get started, just kind of learning more about my program. And also Instagram, if they want to message me on there, it's the Happy Dentist, _ at the end. I'm welcome. You're welcome to reach out to me there, and we can chat a little bit more about how I can help with the implementation process of sleep apnea.
LinkedIn, you're using LinkedIn proprietary?
I am on LinkedIn too. Yes.
All right. Emily, Dr. Emily Stopper, thank you very much for your time today. I know you have another appointment with your client. I appreciate your coming to our podcast today. I hope to have a couple of other episodes with you in the future. But thank you again for your time today. I hope you have a wonderful Friday.
Thank you. You too. I enjoyed it. Thank you so much.
Have a good one. Take care, Emily.
You too. Bye-bye.